It's my pleasure and honor to introduce our next speaker, Dr. Elka Jacobson-Dickman, and there are her credentials there. She oversees the core clinical and advanced clinical medicine years of the Integrated Pathways curriculum here. And she works with the clerkship directors and other rotation directors to assure the highest educational quality and supportive learning environment for our students. Just a little bit about her background. She got her Bachelor of Science degree from McGill University in Montreal. And then she did her medical degree at Albert Einstein College of Medicine in the Bronx, where she stayed on and did a pediatrics residency there in the Children's Hospital at Montefiore, and then on to Harvard to do a pediatric endocrinology fellowship at Mass General. And then she joined both SUNY Downstate and Maimonides, where she ultimately became the Pediatric Endocrinology Fellowship Program Director. She's had a longstanding interest in puberty and reproductive endocrinology. She's published research in these fields, is co-director of our College of Medicine's first-year reproductive endocrinology course. She's the co-chair of our educational leadership team, and how I've come to know her well, which has been wonderful over the last few years, is co-chairing the Learning Environment Committee. And there's the title of her talk, and we look forward to this. So, Elka, welcome. Thank you.
Thank you so much. And I will admit that coming after Dr. Chase Anderson is a bit of an intimidating spot. But we can always learn something together, and hopefully this will not be an exception. So today I'm going to talk about promoting a cross-generational growth mindset with the aim of optimizing professionalism and wellness in medical education. I'd like to acknowledge that I have worked with this topic and with faculty development and resident as educator development in various venues, including workshops that were developed with Dr. Chang, who's on this, and Dr. Eisner, who I believe is here as well. So I thank them for helping me get to this place in this material development. So we've been talking this morning quite a bit about our identities and how we are viewed and how we're treated. I'm going to flip it just a touch in a sense of how it changes the way we view the world. And really in the spirit of sharing, which we've already started in such a gorgeous way this morning, I'm going to continue that. So I'm going to share my lens of the world, and I really encourage you to at least start considering thinking about your own as well in the various dimensions. To begin with, I'm Canadian, much like my colleague, Dr. Myers. Je viens de Montréal. I am trilingual on some days. I am the youngest of 4 children, which is why I talk a lot. And in this photograph, 4 out of the 6 of us are MDs, and I'm very aware of the privilege of being an MD and coming from a family of MDs in how it allows me to take care of myself in a different way and those that I love. I'm a married person for the last 20 years. I am a person of faith. I am a vehement LGBTQIA+ ally, a parent of queer and gender diverse children. I am a person who has anxiety. And if the statistics are correct, among my colleagues, I am not a minority in this experience. The primary way that I handle my anxiety is through exercise, which I do every single day. Otherwise, I do not have a good day from that respect, and others as well. I've had the great privilege of training and working in various institutions that have complemented each other. And I have to say that Downstate is really the one I think I'm most proud of. And by my terrible hair in this picture, you might appreciate that I am a Gen Xer. And so really what I'm trying to say is that I have my lenses of the world that come from my racial identity, my sexuality, my gender identity, my nationality, my abilities, my generation. And we talked about intersectionality, and I probably don't need to repeat really anything from Dr. Anderson, since they were absolutely clear with their messages. But this is really how we see the world. And of course, it's at different, with different emphases at different times. And really what I'm encouraging you is just to take a second and think about how you see yourself from your racial identity, from your sexuality, from your gender identity, from your nationality, from your abilities, your generation, and how those overlap at different times in your life to shape the way you see the world. And we'll focus on generation today. So you might ask yourself, well, what generation am I? I'm taking out my phone because I have a little game to play, which I hope will work. I hope you'll be able to hear this music. To sort of place yourself along the spectrum, okay? So what I'm going to do, I'm going to play just the beginning of a song. And what I'd like you to say, either in the chat or just unmute yourself and say it out loud, is what TV show does that come from? Which is the theme? Which show is this a theme song for? Okay. I think I chose television because I think that even the way we watched television sort of places us along the spectrum. Were we watching a color TV? Was it a black and white TV? Was it the first TV and you remember getting it? Was there one in the home? Was there one in the basement and maybe one or two elsewhere, and you fought with your siblings and, kicked each other over who had to change the channel? Or did you have a remote? Or was it all on your computer, not fighting for, who gets to watch what, sitting in your bed on your chest as you fell asleep? So even the experience can start placing us. Okay, that being said, let's play for a minute and lighten our moods. Have a listen. You know what? Don't worry about it. It's okay. No problem. But how about this? Who grew up with this show?
Yep.
Yep. What is it?
Reruns.
Yep.
Yes.
I love Lucy.
I Love Lucy.
Yes, Lucy.
What about this one?
Gilligan's Island.
Gilligan's Island.
Brady Bunch.
Brady Bunch.
Brady Bunch.
Bunch.
And anybody know how to sing this one? We want to
Here's
do it
the
together.
story. Lovely
The
lady.
lovely lady.
Aw.
All
How about
All
this?
the family.
Archie
All in
Bunker.
the Family. Archie Bunker. What a character, for better or worse. How about this one?
Oh,
Facts
yeah.
Different strokes.
that's Facts
Very
of Life.
close. Overlapping
That's
cast.
right. That's right.
You take the
Is it
good,
Blossom?
you take the
Facts
bad,
of
you
Life.
Come on, there you have. That's
Have the facts
Awesome.
of life.
Family
So,
Matters.
Fresh
Family
Prince.
Matters.
Fresh Prince of
That's
Bel-Air.
right. Fresh Prince.
Anybody?
Fresh
Fresh
Prince.
Prince of Bel-Air.
Friends.
do,
Friends.
do, 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 do. Awesome. Two more.
Gilmore Girls.
Gilmore.
Yep. And
Brooklyn Nine-Nine.
oh, we're an old crowd. Brooklyn Nine-Nine. So absolutely. So I think what sort of jumped in your head, and maybe you had that theme song going even without the music, and sort of what it conjured for you, maybe helped you along placing yourself in this generational spectrum. So what can we do today other than have a little bit of fun? Hopefully, by the time we leave, everyone will be able to really define what that means. What is a generational gap? And contrast key generational features with a focus on Gen Z, our newest colleagues. And through your unique generational and intersectional lenses, really reflect on the concepts of medical professionalism, of wellness, and all the related challenges and opportunities. Hopefully, you'll be able to appraise challenges in a rapidly evolving educational and social landscape that can contribute to tension between learners and educators, which unfortunately is real. And lastly, we will explore strategies to align our motivations and expectations along this multi-generational continuum of learners, administrators, and faculty, with the common goal is to really optimize our clinical education experience, our wellness, our professionalism. So let's just start with making sure we're all aligned on definitions. What is a generational gap anyways? So it's simply a difference of opinions and outlooks between one generation and another. This can be related to beliefs, to politics, to language, work, demographics, and values. And it's really, in a sense, it's a culture, right? So what is culture? Culture is an evolving sense of who we are based on our values, our social norms, our mass media, our economy. And so since all four are impacted by our generation, we can think of it really as a generational culture. And also, I would just sort of qualify that one person from one generation doesn't mean that you think alike and that your experiences are alike. Again, we have an intersectional view and experience of the world. Not to mention, a generation can span 2 decades or so, and that early generation person is very different than the end. So let's compare and contrast to begin. Firstly, we're working in a time of 5 generations. That's pretty incredible when we think about the diversity that that brings to the table. We have still the traditionalists, although that is a small part of our workforce, those born before 46, baby boomers, 47 to 64, Gen Xers up until 1980, millennials, and Gen Zers. And I loved Dr. Chang mentioned when we were at our workshop, stop pointing to millennials like they're the youngsters. She said, we are in our 40s already. So I kind of, and that got a big laugh, and I really appreciated that. So what is this about? What does it matter, right? So we all come from different significant historic events in our lives. And that is going to affect our professional motivations. And that is also going to affect our preferred communications and our worldviews. And that's all going to shape who we are as professionals. So understanding one another to the extent that one can becomes really important, at least to think about. So let's start with our traditionalists. Anybody want to sort of throw out, what do you think are the significant historic events of that time? And again, there are many, but ones that stand out for you and the world.
World War II.
Mm-hmm. So certainly the Great Depression, World War II, radios, movies. Their professional motivations are considered for respect, recognition, providing long-term value to a family. To the company or the organization. They prefer a personal touch when it comes to communication, handwritten notes instead of emails. And their worldview is about obedience rather than individualism, age equaling seniority, advancing through a hierarchy. And again, this sounds like I'm, sort of painting a entire generation with one stroke. And I don't mean to be overly simplistic. It's just a start of thinking about individuals and where they come from. What about baby boomers? What were the significant historic events between 47 and 64 that come to your mind? Just unmute yourself if you feel like it. Vietnam War, Civil Rights Movement, Watergate, space race. The professional motivations here are thought to be about organizational loyalty, teamwork, sense of duty. Preferred communication is really whatever's most efficient. It may include face-to-face calls. Achievement comes after paying one's duty. Sacrifice for success. competitive. This is a competitive group of individuals, and more individualistic, perhaps, than the past. Now, 10,000 baby boomers retire each day. So this is a shifting structure. Now, a moment of perspective, and I won't be able to play the music, I see, but who knows who these folks are?
Is that the Backstreet Boys?
New Kids on the Block.
New
that's-
kids on the
that's it, that's
but
the other one.
close. These are the new kids on the block. And if you knew who they were right away, or even the Backstreet Boys, you are not the new kids on the block. You are most likely a Gen Xer. And so what are the significant events for the Gen Xers? AIDS epidemic, fall of the Berlin Wall, dot-com boom, high divorce rates that they were raised with and continue to have. They value diversity in the workplace. Work-life balance became more of a topic of discussion. Personal, professional interests rather than the company's interest. Preferred communication, whatever's most efficient, including phone calls face-to-face, much like their predecessors. They do favor diversity in a more deliberate way. They are quicker to move on if their employer fails to meet their needs. They're resistant to change at work if it affects their personal lives. A little cynical, independent, but family focused. What about the millennials? 81 to 96. What were some of the historical events that shaped their formative years and outlooks?
9/11.
Mm-hmm, for sure. 9/11 is definitely very prominent. Columbine shootings and school shootings. The internet, declining job market, high loan debt, the proverbial helicopter parents. They are motivated by responsibility. The quality of their manager is important. Unique work experiences. IM, text, email is their preferred communication. They seek challenge, growth, and development, a fun work-life and work-life balance. Likely to leave an organization if they don't change. They are digitally connected and they tend to be optimistic. Now, the Gen Zers are sort of the, X factor or the Z factor, because they're newest, right? They're our most currently sort of trying to get to know you colleagues. And much like every generation that enters the workforce, folks are scratching their heads. So what are the significant historic events in the Gen Zers upbringing? So life after 9/11, which included global terrorism, the Great Recession, access to technology from a very young age, if not entire life, immigration tensions, our first Black president, rise in LGBTQIA rights and fight for LGBTQIA rights. They are motivated by diversity, personalization, individuality, and creativity. Social media, text, and IM are their preferred communication. And they're considered people who self-identify as, if not addicted, dependent on digital devices, valuing independence and individuality. They prefer to work with millennial managers, innovative coworkers, and new technologies. So what are some dominant characteristics? Let's keep this positive and respectful. Anybody want to, comment on what sort of comes to your mind when we think about this generation, this internet generation, as they say, iGen or Gen Z? Well, folks, think of them as having a lot of integrity, being really open, caring. Does that ring true to folks out there? Integrity leads to honesty and loyalty and advocacy.
Yes,
Being open.
I'm agreeing.
You agree? Thank you, Chris. Openness leads to creativity and tolerance and diversity. Caring leads to compassion and kindness. And so we have to ask ourselves, how could these characteristics influence professionalism? Now, this generation has never seen a world without technology. It's kind of mind-boggling sometimes when you think about it. I mean, these kinds of Google, Wikipedia, YouTube, Facebook, Twitter, the first iPhones, these are all things that I remember, as they evolved in their previous generational, iterations. Instagram, this is not, these are things Gen Zers can't remember living without. That is a very different experience. Technology is present in every aspect of their lives. So I'm just going to ask, and folks, if you don't want to share, that's completely fine too, but I wonder if anything sort of sticks out in your minds as a historical event in your childhood that had an impact. Anybody want to share?
Having to do nuclear bomb drills as a grade schooler. So I guess it was just in the years after Bay of Pigs.
Mm-hmm.
So the idea of nuclear war was palpable as a child.
And so I guess my next question was, how do you think this influenced you or even your professionalism, if you don't mind me probing further?
I've never sort of thought about it until you asked the question. I can't even think.
Okay.
I guess it's always put things into existential perspective, because when you think that the world can end, that kind of changes how you look at every day.
Wow. Wow. That's very interesting.
But that's also coming from a place of privilege too. I mean, I don't have bombs dropping on my head now. And,
Right.
and you don't need nuclear bombs to, inflict harm. And so.
Yeah. That's a really interesting perspective, how it almost makes you appreciate your privilege, your role in life, your job, your just living day to day. Fascinating. Anybody else? Anything in your
Elka,
Yes, Ellen.
I would say that the era of civil rights was an era that I grew up in. Assassinations of JFK, Robert Kennedy, Martin Luther King. And I think that that was the beginning of our sort of venture into equality and equity, health, not just for health equity, but for humanistic equity. And we've gone through several iterations, both positive and negative, but currently we're sort of on the right side of it, not politically necessarily, but where many of us stand. And so that
Yeah, I see that. I can certainly see how that would affect your work at Downstate and health equity.
yeah.
Excellent. Thank you, Ellen. Anybody else?
And I'll share as probably one of the few traditionalists on this call. What I'd like to share is having been born during the war and then and sort of growing up in the post-war years, which were actually pretty exciting in a way, because there was rationing was over, but yet there was still very much a sense of care and caution and not wasting things, et cetera, et cetera. And also, I think a lot of gratitude. And where I grew up in Southern Ontario, there was also a huge influx of individuals, fleeing the war, coming from Europe as well. And there was, kind of its own sort of melting pot at that time. And sort of growing up with that, that kind of experience, but also with privilege in so many ways. And so I think it does shape us, in many respects, and in our professionalism as we get older.
Mm-hmm. That's fascinating. Bonnie, please.
So we mentioned civil rights and the Vietnam War, and I remember protesting related to that. But I one thing that sticks with me is the women's movement. And I remember protesting outside of my high school to be permitted to wear pants to school. And that has stuck with me as you may have to keep fighting for this throughout your life.
Wow.
Mm.
That's amazing insight.
We
Ella
did
Jean.
get to wear pants, by the way.
Oh,
pant-
awesome. Kudos.
A pants suit. Okay? Put that image in your head. A pantsuit on a teenage girl. Oh my God.
Ella Hillary Clinton. I love it. Ella Jean.
The Columbia disaster
Oh, yeah.
in high school, and that we watched these people go up and just explode in the air in front of us. And I think that just always resonates in my mind that just because you can do something, should you do it?
Mm.
Mm.
Oh, what a great share.
Wow.
Ricardo.
Yeah, I would like to add, given that I have a little bit of a different experience because I grew up in Italy, in Europe. And I think that even though I was lucky enough to grow up in the 60s and 70s there, that is after World War II, I think there was something special about having your parents, your grandparents talking about direct experiences with a war, your land, and seeing also the remnants of the war, even 20 years later, we're all around. And that, I think, gives you a certain perspective, especially at the time where, wars can be anywhere. And it gives a perspective of, in a way, of fragility, of collective fragility. And
So
therefore the importance of getting all together, fighting against these things.
Mm-hmm.
Yeah.
Yeah. I mean, I'm just for the sake of time, I'm going to move on. But just to summarize, what I'm hearing is, we're having experiences that make us proud, make us cynical, make us motivated, make us aware of resources, appreciative of our lives, of our jobs, proud, humble. I mean, you could see how it really does shape who you are, and particularly as a professionalism. And I would just share lastly, because it's so direct, that I remember, certainly the AIDS epidemic had a huge impact on me. And I was young. I was quite young. And I remember Eddie Murphy, which I was really not old enough to be watching, and I shouldn't have been, but I was. And, he's a Brooklynite from Linden Avenue, and I don't want to take anything away from his enormous talent, but he had a bit that to this day makes me so angry, where he talked about, basically joked about folks who have AIDS and how that means you must be gay, and ha ha ha, this is so funny. And at the time, seeing the images of suffering, even I think I was 7 or 8, it made me so angry that that was considered funny. And that really, really struck me, and I think really shaped even perhaps, what I do within medicine, forget my attitudes, within medicine. So our formative years really stick with us. So thank you so much. I think I'm going to skip this one just so that we don't fall behind. But I do want to focus a little bit on social development of our newest colleagues, our Gen Zers, because I do think it is different for many of us on this call who are, are millennials or older. But it is important to understand that it's different. And that doesn't mean, I don't say this in a judgmental way. I say it in a let's understand each other way so we can do the best as teachers. As teenagers, many of us might relate to you weren't home unless you absolutely had to be home. iGen or Gen Zers are much less likely to go out without their parents. they're less likely to date. They're less likely to rush out and get a driver's license. I mean, if anyone was like me, the day I turned 16, I had my permit. That was independence, as far as I was concerned. They are less likely to work during school or summer breaks. Now, I think that our population of medical students are people who have less privilege in many cases and do work. So that may not, of course, is not, none of this is universally applicable. Adulting is now a verb. Okay, I think that speaks volumes.
It's so true.
COVID-19 was the experience of many of them as they entered the workforce. That's different. And so when you think about this, you know, I'm asking somewhat rhetorically, how could these differences in social development influence their professionalism? And perhaps not where they're going to end up, but where we meet them at different times and what the longitudinal sort of development will look like. It may be different. And now let's just acknowledge there is some tension, right? We hear it. We hear it all the time. We see it in our kudos and concerns, mostly in the concerns part. There is some tension and I don't think it's unique to this generation, but it's happening and we need to acknowledge it. What do you think it's about? What is this tension? And I'll answer. To a large extent, it's about wellness, right? About the concept of wellness and how we achieve it and what it means to us. And there's more to it, but that's a big one. And so then I ask, is wellness related to professionalism? Because in the end, professionalism is our duty. That's a competency. We got to teach it. We got to nurture it. We have to evaluate it. So I'm going to take a step back and talk just a little bit about professionalism and wellness. Professionalism itself in medicine was defined as early as 5th and 3rd centuries BC with the inception of the Hippocratic Oath that many of us are very familiar with. It continues to encompass values, attributes, and behaviors such as humanism, altruism, accountability, excellence, honesty, and respect for others. A cross-sectional survey of almost 2,700 medical students found that respondents with burnout were more likely to engage in at least 2 unprofessional behaviors compared to those without burnout. And a meta-analysis of over 24,000 interprofessional health givers showed that burnout was associated with poor quality of patient care and reinforced essentially the cost to professionalism post-training. So is burnout prevalent, and what's the impact? I think we all know the answer. It is prevalent. Physicians are now at 40% higher risk of burnout than workers in other fields. Back in 2019, more than 300 doctors were dying by suicide each year. That's about 1 per day. And if I'm not wrong, I believe these numbers have gone up through COVID and beyond. This is really a strong statement. Suicide is the most common cause of death among medical students and male resident physicians. And after accidents, it is the 2nd most common cause of death in residents overall. Now, you may say professionalism is a curricular competency. Does it even encompass wellness? And this is something we talk about a lot. Well, let's look at the milestones. Okay, professional behaviors. So there are behaviors. There are principles, part of these as milestones for this competency. Accountability. And what do we know? Well-being. Well-being is wellness, including high levels, like not just recognizing personal factors and institutional factors that impact well-being, but in the highest competency, this is for GME, that our GME graduates should know how to coach and support colleagues to optimize well-being. So i.e. level 5, and my GME colleagues are welcome to correct me, that's supposed to be an attending level. So that means that's what we're all supposed to be able to do. So why is this a tension? Okay, we know it's important to prevent burnout. Burnout is a hindrance to good practice of medicine. We know it's prevalent. Okay, it's a competency. It's frankly our responsibility from our oversight bodies. Why is it attention? What do you guys think? Why is this a source of problems between us and our junior colleagues? What's the struggle? What's the tension? Why don't we just say, yeah, of course. We need to teach, we need to nurture wellness. This is not a problem. This is nothing different. Well, I'll tell you, some people struggle with how do we nurture wellness, but yet set and maintain standards of excellence. Somebody might wonder, how are we going to prepare them for medical practice if it's not as rigorous as it needs to be, as rigor sometimes counters wellness? Where's the point of healthy struggle, right? That's a really important question, a really hard one to answer. And how do we role model and encourage wellness when that was not necessarily a discussion that we had during our own experience growing up in the medical system? Do any of these questions resonate?
Yes,
Yes.
the last one. How do we role model and encourage wellness, well-being? I think, Elka, I'm so glad that you put that up there, because I think when clinicians do that, they have a huge impact on their trainees. An example would be, I think, a clinician who says, looks at his or her watch and says, we're going to make rounds, but we're going to make these rounds smartly. And because I have to get to the daycare, or I have to do this or something like that. I have a life outside of medicine, and yet doesn't sacrifice any of the important teaching. And that really models just very good. And also you can just tell that this is an individual who does place a certain premium, of course, on their personal life, which is, as you know, is that dialectic always, I think, for us in medicine, trying to balance our personal family lives with our professional calling.
If I could also add to that too, I think it's also perceived, I think, as a weakness. Like I can't be weak. And if I'm tending to my wellness, I must be weak because something is wrong with me. And so I think that's everywhere. The dusty corners of everybody's psyche is a part of that. And also I think in this way, as it's sort of a quote unquote outsider of medicine, this is built into the profession. It's like you have to self-sacrifice. So I can't tend to myself because I have to tend to others. So there are all different ways in which that kind of gets messed up. And I think at the end of the day, that is what underlies all these other issues. How can you be prepared for medicine if you can't encourage your own wellness? How can you take on a healthy struggle if you cannot tend to your own wellness? How can you maintain standards if your standards are perceived to be skewed to only value strength? And if strength is seen as not having to worry about your wellness, then that gets messed up too. You know what I'm saying?
Yeah, it's like self-indulgent, and
yes,
so I'm so glad.
Right.
I'm so glad that you guys both, sort of brought up the role modeling as the challenge, because this is my first strategy that I really want to talk about. So I couldn't have sort of asked you to set me up better. And I think both of you really brought up such important things about role modeling. It's really about talking about it. It is doing it and talking about it, sharing, right? And this theme comes up. So talking about the food you're eating, the food you're preparing, right? Eating healthy, taking care of your body, taking care of, I'm sorry, folks, I'm going to have to leave early today because I'm going to the doctor, to share whatever you feel like sharing, but actually taking care of yourself. How many times do we have doctors and we talk about how they don't even have a primary care physician? Right. And I think this is really almost like it's a badge of honor. Like, oh, I couldn't be bothered to take care of myself. I only take care of others. No, that is not good role modeling in this sense. Taking care of your shop, spending time with your family. Okay. Spending time with your junior colleagues outside the walls of the high pressure patient care situation. Here I am at the AAMC, at Gold Humanism, celebrating our students' successes together. And I know many of my colleagues here do that on a very regular basis. It's so enriching, not just for us, but for our colleagues, our junior colleagues. See us in jeans running around, to catch a flight. Yeah, Chris, please.
I was just going to say too, it's sort of this bizarre contradiction. It's like you're not promoting your own profession because you're not partaking in it.
That's right.
It's sort of othering patients in an even more extreme way. Like we were talking about othering. I mean, what we didn't sort of name as othering, that's what we were talking about for a lot of this. And minoritization is a form of othering. It's just weird.
No, you're absolutely right. That what separates us from our patients, just our roles in that moment. But we are those people to somebody else. We are all human. So I agree 100%. And also nurturing our friendships at work, right? Having our colleagues, we spend so much time with our colleagues. Why shouldn't they be our friends? Why shouldn't we enjoy spending time together? I mean, Melanie, if she's still on, I hope that you agree that when we were taking these photos, we were having the best time. Celebrating birthdays together. Here are my colleagues who brought me a present, a gorgeous birthday cake. I loved that. That made my day amazing. That made me want to come back to work the next day. So these are the things we have to do, and we have to talk about, and we have to share. We have to inspire each other, okay? I think everybody on this call knows Dr. Quinn and Dr. Bianchi. You may know that they are marathon runners. I mean, how awesome is that? So awesome that at 48 years of age, never being able to run more than a block, I decided I was going to give a go at it. And you know what? I'm not going to catch up to either of them. But I did do 3 half marathons in the last year, and it was so much under their inspiration. In addition to texting Ricardo about meetings that we need to chair and such, I also ask him what I need to eat for breakfast the day of a race, and all kinds of other inquiries. So this is the kind of role modeling and inspiring of one another, I believe, really nurtures our lives and shows our students that we're just people. And also that wellness comes from achievement. Right? It comes from accomplishing things. It's not having an extra day off before your exam. It's really not. In fact, there's studies to show that it's not. It's about having accomplishment in other spheres of your life. And that could just mean nurturing a family, which is a very big accomplishment. Now, another strategy that I'll go into is cultivating optimal teacher-learner rapport. And this is something I've talked about before, so I hope it's not repetitive, but it gets down to actually a theory that Dr. Anderson referred to, which is cognitive load theory, which is a balance of intrinsic load, which is the difficulty or appropriateness of the level of what you're learning, extrinsic load, which is distractors, which could be in the form of micro and macro aggressions, alarms, jargon. I mean, it could be major things, it can be smaller relative things, and germane load. And germane load I want to highlight here because germane load refers to the psychological or mental energy a person needs to apply to form new skills, to accrue new knowledge. And that's really how they're feeling. And that comes down to, I believe, at least to some degree, how much they trust their learners, how their teachers, how much they, in a sense, quote unquote, love them. And I use that word because this article really sort of put into words something that I had been thinking for some time, which is that if we share a little bit, there's something that clicks for the students, that you are now a person that they can trust. And Dr. David Brooks wrote about this, how it was a very simple story. He was working at Yale as a professor. One day he had to cancel a class. Instead of saying, just sending an email, it's canceled, sorry, he went to class anyways, and he shared with them that he had a personal circumstance and that he had to go. And that was it. It wasn't a huge share, it was a small share. He believed at the time, but he gave them that respect. He said from that point further, there was something that shifted. There was a trust that was built. There was a mutual respect that came out of that moment. And he became a better teacher to those students. And that's why, that's how he attributed that change. Now, the word love still sort of stuck with me with like, well, is that really appropriate, that word in a setting like ours? And then Pat Lee took it a step further and sort of defined it in a professional setting. Pat Lee, you may know, was the inaugural chair of medicine at One Brooklyn Health, has now moved on to Texas. And he wrote a paper called Leading with Love, 5 Practical Tips. He's spoken at the LEC before. And what he talked about, that in the professional setting, love is about the quality of attention you give somebody. And he said it is possible to lead with love and discover abundance among teams who feel safe, cared for, and aligned towards common purpose and professional growth. And I'm going to skip this slide because I think we've talked quite a bit about sharing, and I'm going to talk about our third strategy, which is creating psychological safety. So who knows what this is, this term psychological safety, which I'm going to prelude by saying it's much more than telling somebody you're in a safe space. So it's a perception of the consequences of taking interpersonal risks in a given context. That's kind of a dry definition, but it is not a stable condition. It is dynamic and it is fragile and it takes a lot of work. And I encourage folks to check out, this is Michaela Colby put together a paper about creating psychological safety. And it was in the context of debriefing after simulation experiences. But I think a lot of the methodology, which is very specific and very concrete, it can be very helpful. And she separates it into implicit and explicit strategies. Just creating an environment, circular seating when possible, moving around, not necessarily having the hierarchical head of the table, clarifying expectations. We talk a lot about that with our faculty when it comes to beginning of learning sessions, beginning of a clerkship, sitting down. What are the expectations? Not moving those goalposts, as Dr. Anderson talks about. Being authentic, being inclusive, using language that's inclusive. Those sort of intangible, like facial, non-verbal expressions, essentially making people feel okay about making errors. Because if you do, you have improved creativity, engagement, performance, and learning-oriented behaviors, which essentially are things like speaking up, asking for help, saying you're wrong when you are, sharing the assumptions that maybe were incorrect. And if we don't create psychological safety, is it just that people won't be optimized? No, they will be hurt, okay? Medical learners who experience shame are more likely to withdraw, to hide, to deny responsibility, to ignore problems, and respond angrily. Residents who have been shamed are more likely to experience burnout symptoms, including depersonalization, depression, isolation, and basically not be as good doctors as they need to be. Okay, of course, shame causes avoidance behaviors, and this is going to harm students' confidence, their motivation, and their professional identity formation. Now, again, coming back to our generations, who remembers where this is from? These folks? Which show?
Scrubs.
Scrubs, that's right. So I all love this because they were interns when I was an intern. And this was the pilot. And the scene goes like this. There are these new interns and they're really, really keen, and their beepers go off, and it's the call, it's the code beeper. And you see them running like chariots of fire slowly down the hall, and you presume they're running to the code. And of course, they are not running to the code. They are running to the supply closet where they find each other, and they each want to be able to hide there and are embarrassed and angry that the other, found out their trick. That's what happens when people are afraid of shame. They run away from experience. They need to run to experience, because through experience, they are going to become better and better doctors. So lastly, I'm going to talk about a term, reciprocal mentorship, which Dr. Eisner, who I think may still be on the line, was earlier, and I talk a lot about. And certainly it's an approach that many of us use, Dr. Roman and Dr. Booten Foster in their HEAL pathway, and certainly in the med-ed pathway, and in many other circumstances where it involves students. And really what it means is that we're just working together and learning from each other, and growth mindset. Okay. So Carol Dweck, a PhD psychologist from Harvard, was the one who coined this term, growth mindset. And she said that individuals who believe their talents can be developed, hard work, good strategies, input from others, that's somebody who has a growth mindset, and they are likely to be more successful, to achieve more in their careers than those with fixed mindsets, who believe they're just have these innate talents and gifts and don't necessarily benefit from input from others as much. And so I think that that's really a key to our success when it comes to integrating the motivations and the support across generations. And C.S. Lewis said something that I think speaks to this concept, which is that true humility is not thinking less of yourself, it's thinking of yourself less. And so with all of these things in mind, I'm just going to check out our time. I wonder if anybody would be willing to say, some way that they were able to have a really good learning moment, either for themselves or some successful bridging of a gap between their generation and our Gen Zers. Would anybody like to share a successful moment?
I think I was paying a lot of attention to the communication styles you spoke about with the different generations and how it's become more and more impersonal. And especially for the Gen Zers, they prefer text or email, something that's more impersonal than even a phone call. But they still need that personal connection. And I find that every time when I reach out to my students and just take the time and have a discussion with them privately, one-on-one, they are so appreciative of it. They say, oh my goodness, like it was some big event, big sacrifice on my part. And it really wasn't that big a sacrifice on my part, but they're so appreciative of it, so that we should still try to make those, personal connections, even though they may not prefer it.
I love that example because I think it also speaks to creating psychological safety and nurturing the relationship with our learners. So 2 out of the 4 strategies right there. Thank you so much, Ella Jean. Chris, please.
I'm so glad that Ella Jean is on the Zoom, and I'm not entirely surprised. I had the good fortune and privilege to be the MK partner for the PBL group that Ella Jean facilitated. So I hung out, especially, in the pandemic. That's where I really spent more time. And as you remember, as we all do, that was the one modality that, students had to come in person. So we all wore masks, whatever, in the carols. And after that, years later, I still had students coming back from that group saying that with you and Dr. Richards, that was a lifeline. That meant everything. Having that we felt safe, we felt validated, we felt seen. I think, I'm so grateful, to Ella Jean for really leading the creation in a very intentional, assertive way of having an environment of safety and sharing personal stories and talking about, family life and balancing work life. This is to first-year medical students during a terrifying time, when, everybody was facing sort of this existential crisis. So yeah, I think that's all part of it. You have to create a safe space where students feel seen, validated, and loved. Through that appreciation, you just are so glad that they're there. You feel lucky that you have their trust, right?
Yeah.
And they need to understand that as students, that we value the trust that they're putting in us.
Yeah, I hear. I thank you so much. Those are both incredibly complimentary and perfect shares. And I would love to hear more, but I think in the interest of getting back onto our schedule, I will stop and hand it back over to Dr. Myers to